Artificial intelligence. In the future, I wonder if it's going to be seeing patients independently, diagnosing them, reviewing their images and sending them on their way with their treatment. Nah, I don't think so. I think that we're a long way away from that happening. Rather, what I see is tech augmenting us doctors into something like Iron Man. Today, I want to talk about 3 specialties that I think are going to see huge transformational shifts. Number 1, general practice. General practice is notoriously difficult because of the 10-minute slot. How are doctors expected to extract information, examine patients, diagnose them, treat them, and do all the relevant admin whilst being sensitive to the patient and giving them the time they deserve? It's a losing battle from the start. So where do I see tech come in here? The AI assistants and co-pilots I think will have a huge impact here. Imagine a consultation where the GP is just conversing with the patient. No typing whilst talking. And in the background, that conversation is appropriately being recorded and documented. The GP can at the end then review it and instantly prescribe, order investigations and make the appropriate referrals. I see AI here as really helping GPs with the administrative burden. Now imagine that very same AI assistant, whilst listening to the consultation, is able to analyze the symptoms and signs it listens out for. Say it can then also scan the patient's medical history and historical data on the system and then suggest the diagnosis and treatment after referring to the evidence and literature base. Now this is going to be helpful because it doesn't impede the doctor. They would through the consultation still come up with their own differentials. But what if they missed one that AI could suggest? The GP would be here able to diagnose and treat more efficiently and accurately. There's also less cognitive load and stress on the GP now. And by the way, GPs could actually already do this. If you gave them 1 patient per day, they could probably treat that patient with 1,000% accuracy, efficiency and efficacy. But the challenge is they only have 10 minutes. Now 10 minutes is a whole different ballgame. How we do everything in that 10 minutes is the challenge that tech I think is going to solve. Now the second way that it's going to transform general practice is in its delivery of preventative care. I see tech here playing a big role. Patients are nowadays wearing remote health tech equipment, or they've got them in their homes nowadays. What if those devices could communicate with the GP systems? What if it could help the patient triage themselves towards GPs, A&E departments or other healthcare providers? It would generally help the patient and the healthcare system avoid that car crash moment. So AI and tech in the hands of general practice I think is going to be a game changer when it comes to providing preventative care. The next specialty that I think is going to be transformed is surgery. Training I think is a huge challenge nowadays. There is a huge burden on junior doctors and consultants and the healthcare systems to think about training, and how are we going to get future consultants who are capable consultants. Now I'm hearing colleagues are having to need extra fellowship years on top of their training to get more numbers in terms of operations under their belt. Why is training years not enough to hone the craft of being a surgeon, then needing extra years to get extra practice in? So a great example here of a health tech company that I really admire is Innovus. I simply love their mantra of training surgeons like athletes, training them with simulation to practice real life surgeries and simulating it to be real as possible. So here, digital health tools are making training safe, accessible, and also hones the craft to, I'd say, another level where we have not just competent but excellent surgical consultants. Now, just like general practice, I think tech in the field of surgery will help in the diagnosis, investigations, monitoring and treatment of surgeries too. But let's talk robotics. I'll never forget the first time when I was a student and I saw the Da Vinci robot, and then when I used it myself. Here I was in this bot in one corner and the robot itself was over the patient. Now, robots in the hands of trained surgeons I can see as providing better and more accurate surgeries with lower complication rates. Imagine AI and other machine learning algorithms being able to guide a surgeon or predict or suggest the complication should a certain action be taken. To all those that are now thinking, well, if that's the case, one day surgeons will be out of a job, no? I think surgeons can sleep comfortably knowing it's a long time till we can accept a robot doing a hemicolectomy with no one in the room but the robot itself and maybe an anaesthetist. Would you allow a robot to just operate on you with no supervision at all? The third specialty I think is going to be radiology. Now, I've spoken to radiologists about this, and to one colleague of mine, I kept asking, quite annoyingly actually, but what if AI does it better though? What if it can read those scans better than you? What if it can holistically look at those scans too? The consultant radiologist didn't even flinch. I think he thinks we'll all be dead before AI reaches that stage. Anyways, I'm not here to debate whether AI will replace radiologists, or not in 20 years at least. What I do know is radiologists who know how to use AI to augment their talents will replace those who don't. And that will be within the next 20 years for sure. AI will be able to generate interim reports for other physicians in time-critical moments with a high degree of accuracy. I once, during work myself, saw a CT scan with AI interpretation. It was available to myself pretty much immediately and allowed me to take action. So I've experienced how in real time it reduced the diagnosis and treatment time, improved efficiency and accuracy. Of course, a radiologist did interpret it pretty quickly and it matched. I assume it quickly flagged the finding and so the radiologist was on it sooner rather than later. All in all, I was pretty impressed. So tech and AI will be able to triage better for radiologists. Say if today there are 100 scans, all of them need reports. There's say only 3 radiologists. Some scans are low risk whilst others are high. What if AI could triage them, report them all, but highlight the high risk ones so they're at the front of the queue for the expert radiologist? Again, better care provided to more patients, more efficiently and timely. To be honest, currently there aren't enough radiologists in the world, so AI is happily welcomed by the radiologists that I know. The other department I see AI and tech helping in radiology is in the educational side of things. AI could be the companion helping train very junior radiologists. What if juniors could train to expert level even faster and better? We could have a radiology workforce that are at a higher level for those complex scans that tech and AI is still far away from. Now, I think we're still a long way away from letting tech and AI independently report with no second review by a consultant radiologist. But I think radiologists will definitely enjoy having these tools at their disposal. So there we have it. I think GP, surgery and radiology will hugely benefit from tech and AI. They're not the only specialty, but I'd love to know your thoughts on how you think other specialties, maybe your specialty, how it will benefit from tech and AI.